Hi, my name is Dr. Stelina Gowdy. I am a family physician practicing in Athens, Georgia at Gowdy Family Care Center. And the topic that I'd like to talk to you all about today is diabetes. So first, I'd like to start with what is diabetes? So diabetes is a condition where the glucose or sugar is not being moved from the bloodstream into the cells. What allows that process to happen is insulin. There are two types of diabetes, either type 1 or type 2. There are other kinds, but for the purpose of this video, we're going to focus on just type 1 and type 2. In type 1 diabetes, what happens is that it is a autoimmune disorder and your body essentially destroys or attacks the insulin. Now, the only treatment in this case is insulin because essentially the insulin is being destroyed. The diagnosis of type 1 diabetes typically occurs as a young child or as a young adult. Now, in type 2 diabetes, what happens is it's more of an insulin resistance that is happening over time. There's different levels where we diagnose it. So sometimes it's very early when your A1C, which is your 3-month average of your blood sugar, is between 5.7 and 6.4. That is what we call prediabetes. At that level, medication does not have to be prescribed, or you do not have to take medications. You can control it with just um, basically diet and exercise. If you'd like to start medicine, sometimes some providers will go ahead and treat since you're essentially potentially heading into diabetes. However, treatment is not required, and essentially it basically is time to start making some significant changes so that you do not develop diabetes. Now, if your A1C is greater than 6.5, now you are truly diabetic. Between 6.5 and 7, you may still be able to control it with diet and exercise. However, greater than 7, best thing to reduce the risk of complications is to go ahead and start medications. Now, what happens with type 2 diabetes, which is a condition that commonly occurs, sometimes it's more just genetics. You're just at a high risk because people in your family, parents or siblings, if there is a genetic component, so maybe more genetics. Physical inactivity, if you're not exercising and your diet is not the best diet, you're at higher risk for developing diabetes. So those are definitely some of the most common causes of developing type 2 diabetes. Of course, weight, being overweight will also increase your risk. The treatment for type 2 diabetes can be different forms. I already talked about the diet and exercise. Basically, what happens when you're exercising is that your body is needing the sugar or the glucose to be able to maintain your exercise level. So your muscles is needing that sugar. Therefore, it's a natural way of reducing your blood sugar. As far as the diet, if you're reducing the carbohydrates, carbohydrates produces a lot of sugar or glucose. So if you reduce your carbohydrate, you end up producing less sugar, essentially reducing the amount of sugar that's in the bloodstream. Now, as I mentioned, at a certain level, you can control it with diet and exercise. However, if we're not able to control it with diet and exercise, it is really important that you go ahead and start medications. Medications come in different forms. It could be either oral medications. Oral medications essentially help with allowing that blood sugar to be decreased by creating or making sure that there is more insulin in the bloodstream. Also, The injections. There are non-insulin injections. Some of the common ones that you may have heard of that are used for weight loss include things like the Ozempic or the Mounjaro. Essentially, similarly, helps with reducing the blood sugar in the bloodstream. The other one that is as commonly advertised is like Trulicity. All three of those are once a week injections, but they are non-insulin injectables to help with controlling diabetes. And then the next one is the insulin. Over time, as diabetes progresses, it is very common that you do need to use insulin because, as I mentioned, insulin is what it will reduce essentially the blood sugar by moving that sugar from the bloodstream into the cells. Some of the complications that you can develop if the blood sugar remains too high, which essentially happens because the blood sugar is depositing in places where it should not. For example, starts to deposit on the eyes, which can lead to blindness. It's just not a place where there should be increased amount of sugar. So not controlling your blood sugar can lead to blindness, kidney disease. If your blood sugar remains too high, it starts to affect your kidney function, which then can eventually progress to something like dialysis if we're not making sure to make some changes very early enough to help with reducing the blood sugar. Also, neuropathy. A lot of people say, or once they start to develop numbness and tingling, then they say you have diabetes. However, it's something that can happen over time. And if the blood sugar is uncontrolled, that's when you'll start to have those kind of complications because it's depositing on the nerves, leading to the inability of the nerves to function correctly, and then leading to neuropathy. So those are some of the complications that can happen due to diabetes. So it's really, really important to control your blood sugar through those different means. And even if you are on medications, it is still important to monitor your diet and to exercise to help with not needing as many medications to control your blood sugar. If you're looking for a primary care physician who is comfortable and happy to treat your diabetes, happy to see you at Gowdy Family Care Center at 1500 Oglethorpe Avenue, Suite 3500. You can call us at 706-410-2684, or you can find us on the web. You can even schedule an appointment online at www.gowdyfamilycare.com. Looking forward to seeing you.